Once you, as a patient, have determined that you'd like to have a surgical procedure, then one of the things you might be asking yourself is, am I going to heal satisfactorily? Now, how your incisions look, the ultimate scars look, really is determined very much from before the surgery. Of course, we'll help you prepare by having you do all the right things so that we minimize bleeding and we can do the best operation we can. Part of that is not putting any tension on the wounds. And so, for example, when we do a facelift, we make sure that we're not trying to pull the wounds too tightly, because if so, that can cause a widened scar. Also, we use the finest sutures and we place them meticulously so that we can assure you and ourselves that we're going to get the very best possible scar. Now, sometimes patients say, well, I have this terrible scar here, and they'll show me a scar on their abdomen or their knee. But the scarring there is totally different than the scarring on the face, because the face generally heals much, much better with respect to scarring because of the better blood supply. Also, what's very important is the place that we place our incisions. So in general, we try to place them in crease lines so that they're very well hidden, and they just blend in so that if they look like anything at all, it may be a very fine little crease. Now, post-operatively, we take care to get you a good scar so that once we remove your sutures, we place little tapes on the wound. And in this way, what will happen, we'll take tension off the wound and help you get a fine and flat scar. Now, some people will get an increased scar formation. It's just natural for some people to do so. We call that a hypertrophic scar, which just means excess growth. Should this occur, we can usually manage it with a type of ointment that we have you place on the wound, and sometimes a little injection of steroid to help slow down the rate of scar healing. Many people use the term keloid, saying, I'm worried about being a keloid scarer. These people are very, very rare and are much more common in patients of darker skin. A keloid scar is quite different from that hypertrophic scar. The hypertrophic scar stays within the confines of the wound itself, whereas a keloid scar is one that can grow outside the confines of the wound and tends to keep on growing. These are really very, very rare in cosmetic facial surgery. The bottom line, using our skills, and in most cases the patient's own good genetic makeup, the vast majority of scars that form from having had cosmetic surgery are very well hidden, very fine, and in many cases not seen at all.